Hello everybody, my name is Giulia Cortellesi and you're listening to the Early Childhood Workforce Initiative webinar. The initiative is hosted by International Step-by-Step Association and Results for Development. This year's webinars are coming to you thanks to a partnership with international child development initiatives. Before getting on the topic of today's webinar, I'd like first to acknowledge the financial supporters of the Early Childhood Workforce Initiatives. Bernard Vallier Foundation, the Elma Foundation, Open Society Foundations, and the Jacobs Foundation. And of course, a special welcome to you, the listeners, who are joining us today from all continents. Our topic today is about challenges and opportunities in integrated early years services, a spotlight on the workforce. Integrated services adopt multi-sectoral approaches in the early years, which integrate parenting support, nutrition, health, social protection, child protection, and education. We're going to be talking particularly about the conditions for interagency work from the perspective of those in a position of leadership in the early years workforce. These are the issues that we thought it is most important to address. You find them on your screen now. What is the role of the leadership in ensuring positive attitudes and behaviors are valued and promoted? How can professionals develop a more enabling, welcoming, participative, and inclusive work attitude which ensures that parents and carers and children receive the services they actually deserve and want? Can you have a successful integration of services when services are located in different buildings or different locations in the same community? What are the characteristics of a coherent policy on institutional and interinstitutional levels for integrated early years services? We also already received many questions from you, the listeners, to this webinar, and made a selection of those. We will ask our panelists to address your questions during the discussion. Here you can see a slide with the 5 of the questions we have selected from those we received. I'm delighted to introduce our panelists today, all of whom have an extensive research, policy, and practice experience in integrated early years services. Firstly, Jacqueline Barnes, Director of the Institute for the Study of Children, Families, and Social Issues at the Birkbeck University of London in the United Kingdom. Welcome, Jacqueline. Among other things, Professor Barnes was one of the directors of the National Evaluation of Sure Start in the UK, a very prominent example of integrated services for under 5. She's currently an investigator in the European ESOTIS study, leading the work that examines interagency collaboration. Our second panelist today is Jan Peters, Director of BBJK, Center for Innovation in the Early Years in the city of Ghent in Belgium. During his career, Jan led many innovation and research projects in Belgium and Europe on professionalism in early childhood education and care, and was involved in advising local authorities and service providers on how to support collaborative work and organize integrated services for disadvantaged families and children. Welcome, Jan. Before handing over to Jacqueline and Jan, I will quickly explain how we plan on using the next 75 minutes or so. Compared to the 2 early webinars this year, we're trying a new approach today. We have not asked Jacqueline and Jan to prepare a presentation. Instead, we asked them to reflect critically on 4 statements and questions and give us their views and opinions on these issues based on their knowledge and experience. The statements will appear on your screen, as well as some illustrative materials, slides, and videos that Jacqueline and Jan wanted you to see. We will spend about 10-15 minutes on every statement. After that, we have reserved some time to address your questions. If you would like to submit questions during the webinar, you can of course do this by typing this directly in the questions panel on the bottom right side of the screen. Finally, the recording of today's webinar will be available on the website, just in case you need to leave early or you would like to recommend it to your colleagues to listen to. Now, I'd like to invite you to watch a short video about the Children's Centre established by Sure Start program in the UK, which will introduce us to one of the possible forms of integrated services for young children and their families. We hope you enjoyed the video. The idea was to introduce you to one possible example of integrated services. These are the Sure Start centers, children's centers in the UK. Since the Sure Start system was established in the late 90s with a mission to provide help to young children from disadvantaged backgrounds before they started school, the program has faced many challenges. Many centers have been closed or merged with other services, and their impact on children's well-being has been also evaluated. Jacqueline, one of our panelists today, was one of the directors of the national evaluation of Sure Start in the UK, and more recently she has been researching integrated services for the European project ISOTIS. Among other findings, your research, Jacqueline, indicates that the integration of services at a managerial level does not always ensure the effectiveness of professionals working together on the front line. We have identified a number of barriers and enablers to integrated work and put them into a table that you can all see on your screen now. Jacqueline, what do you think about these barriers and enablers, and what is, in your opinion, the role of the leadership in ensuring positive attitudes and behaviors are valued and promoted?
Welcome everybody. It's nice to be able to talk about Sure Start, but it's a very interesting story. And I think that to discuss leadership, one has to go right back to the beginning of Sure Start, because it was from central government that this program was planned, and the different ministries, health, education, the Home Office, work and pensions, the Treasury, the Cabinet Office, initially were all involved in creating the idea of these programs, and it was very ideologically driven. Tony Blair was one of the prime movers of this initiative. And in fact, the whole idea was started by a Treasury official who Gordon Brown had commissioned to work out how to reduce the impact of poverty for children. So it looked very integrated in terms of working together at the very highest levels. But unfortunately, that didn't last very long, because there's always has to be a decision about where the actual service is placed, who's running it and what ministry it's in. And once it was positioned within the Department of Education, the other ministries fairly quickly lost interest. And that's sort of as an example of the fact that there are lots of barriers to holding together even sort of the whole idea of it at the very highest levels, for the reasons that you see: turf warfare, rivalry, status inequalities. Some ministries feel they're more important than others. Probably the only thing that you wouldn't see for that is poor working conditions, because they've all got quite good working conditions. But that then translated to leadership at the local level. Again, ideologically, the plan was that these programs would be run by a board, put together at the local level. People could decide who should be on the board, but it had to have a representative from health, from education, from employment, from social services, plus voluntary agencies, plus local parents. And they all had to get together and create a board almost instantly, with no ideological discussion, because there was money there and they had to get together so they could get the money and then start working on improving services. And of course, I gave a handout which shows the sort of process that often happens with interagency working, that it doesn't happen overnight. You get conversations, you get coordination, collaboration only at the very end of the process. But this all had to happen within a matter of weeks, which meant that people really didn't have the same sort of values and ideas. They just were more or less pretending to, so that they could get this service off the ground. And that really did affect how the service was implemented. And you'll see in the video, they said that they wanted the families to tell them what services they wanted. Well, that's sort of good in a way, but leadership has to come as well to sort of decide what mix of services is best for the community, which requires needs assessment and a careful planning and balancing of what money there is and how to spend it. And that was not taking place in a lot of areas, so that the services are very chaotic and lacked good leadership quite often. And what we found, unfortunately, was that when you took these programs and looked at their impact, in the first years, that there was not getting the impact that the original government agencies had hoped it would. There was some effectiveness, but not the, you know, there was the idea of letting 1,000 flowers bloom. Well, there should have about maybe 200 blooms, and the rest were sort of struggling, and probably 100 or so were really never getting past sort of seeds coming out of the soil. And so, and that was because there weren't actually sufficient numbers of people in the area who were skilled at leadership. And that was what we found when we looked at implementation. People didn't have the knowledge of how to bring agencies together, how to make decisions about spending money, how to, they had to build buildings very quickly, these centres didn't exist then. They had to commission builders, architects. There wasn't in early years the sufficient skill set to be able to have leaders who could manage all of that successfully. And that really did mean that the programme faltered in lots of places. And we did actually find that if you looked at, we created a scale which included leadership as well as multi-agency working, and that scale was related to outcomes for children and parents. So if that was successful, there were better outcomes, and if it wasn't successful, the outcomes weren't there. And that's one of the things we managed to show in our first wave of the evaluation of Sure Start. And that's what led actually to some changes, and the plan was to make them tighter, more like centres and not so driven by the community. But it really is, I think, a sort of a lesson. I was interested in the video that this was obviously pre-2010, and as he mentioned, there are not 3,500 children's centres now in the UK. There were possibly up to 3,000 at one time, and now there are fewer, and that's obviously because of political leadership. So, you know, there are all sorts of reasons why interagency work and idealistic work like that can't be maintained, because local authorities have decided that they want to spend money in different ways. So I think it was a very good idea, but it does need much more careful, slow progress to bring people together so that they share, have mutual respect, they just make decisions together, they communicate. Obviously the common training has to come down the line, but it's the trust and the shared values that are needed, and that didn't happen in all cases with Sure Start. Sorry, I've probably spoken for too long, but I'll hand back again now.
Jacqueline, thank you very much. One of the speakers at the recent ISTA conference in Ghent said that integration is a state of mind. And of course, she put the emphasis on how important it is to create a shared vision and shared strategy and plan. What's your experience from the Sure Start program about creating a shared vision among services and among policymakers?
Well, that was the problem. The idea was that there was this shared vision shared with Tony Blair and the sort of central government about what should happen. But locally, people had different ideas. And because each partnership board could make their own decisions, some focused almost completely on services for parents and not for children. Some focused on enhancing early childcare and early education. Some thought that employment was the most important thing, and so there was no shared vision. It was a vision that poverty is a bad thing and that we must try and help families in these disadvantaged areas. But there wasn't really a shared vision about how to achieve that, because there wasn't good enough guidance from the central government about what sort of things they should be providing. And they realized that after about 5 years and tried to tighten up the sort of recommendations, but still it could never be demanded that they spend the money in certain ways. And that was, you know, the whole thing was that bottom up was good because local communities knew what they needed to have, but in fact it actually created a rather messy service that wasn't coherent and didn't have a shared vision.
Thank you, Jacqueline. I was wondering where the practitioner used to work together before the Sure Start program was launched, or this was completely new to them?
There were some examples of what was called family centres that existed, and in fact the EPI study, which Professor Melowish from ISOTIS was the leader of, looked and found that the combined children's centres were actually very high quality, but there were few of them, and they were sort of like the Penn Green Centre, which a lot of people would probably heard of. They proved to be successful because they had a history. They'd been created through people planning to work together and it building up over time. And so there were some examples that people tried to emulate, like Penn Green, but they were created through a different process and carry on now, still being successful because they were able to get people to talk to each other and work out how they could work together. But some of the research showed that they had troubles. For instance, the centres had teachers in them as well as early years care workers, and there was a lot of sort of anger about the fact that the teachers had much longer holidays than the other staff and shorter hours, so they would come at 9 when other people had been there since 8, and they would leave at 3:30. They had higher salaries, and so it didn't, there was certainly not an easy process even for those pilot centres to establish themselves.
Talking about Penn Green, they were one of our panelists for the first webinar of this series. I was wondering, do you think that Penn Green example is successful because of their leadership?
Well, clearly Margie is an extremely charismatic and powerful leader who's able to bring people together, and that is an issue that the Sure Start program, as I said, there aren't enough Margies around in the country to be able to have one in each of all of these children's centres, and that does make a huge difference. And we found in Sure Start that one of our scales was called ethos, but that's really created by the leader, and that makes a difference in terms of ethos for the staff, for the families coming in. And it does need to have somebody who's got a range of skills which is not necessarily held by a lot of people. It has to develop over time, and some people weren't as good at doing that as she obviously is at Penn Green.
Thank you, Jacqueline. I would like to give the floor to Jan. Jan, what is your perspective about barriers and enablers to integrated work with regards to the attitude of the workforce and the leadership?
Yeah, first I want to start with to say that I was always very inspired by what's happened in the UK, in Penn Green, in Sheffield Centre, and also in the centre in Birmingham. I visited in the 90s. We in Belgium, in the Flemish community, we didn't went so far, but you will also see a film in a couple of minutes. It's more that we created community childcare centers with some functions outward, but not so many as we have seen in the UK. I was also involved in integration of very different centers in the welfare sector. And together with my experience I had in those community centers, I think that integration is in the first place a kind of a learning process. And we did very recently, the report will be published in a month, a study for the European Commission on learning communities and what's very typical for a learning community. And I think we can learn a lot also for integrating different services. Jacqueline already talked about it. It's so important that we have a shared vision, that we have shared values, because we have to make a lot of decisions in integrated centers, and it must be based on a shared vision of what kind of visions we have towards parents and also towards children. I think that's very important. Another thing is that in the different centers that come to work together, we must have a kind of a shared responsibility, a common responsibility that we have the feeling that we're going together towards a new kind of center. That in my opinion, and also in what we saw in the NICET research is very important. We had to come to a kind of an inclusive belief about what is good for children and also for parents. Another thing I found very crucial is and it's a nice name that I saw from a colleague researcher, and he called it the deprivatization of practice. It means that that you go out of your organization and that you look to the others with which you will have to work together, and that you go to observe how they are doing. For instance, if you work in a health center and there is also an employment aspect in the new integrated center, that you go and look for it, and that you are open for what the other organization is doing. I think it's very important that you give feedback to each other, so that you can come to grow and to come to a new concept of working with children and parents. And therefore, of course, we have to, that's another competence which is very essential. I think that we have to engage reflective and in-depth dialogue. And that's very important, that we are open to each other and that we can listen to each other, very important. And then, of course, you have the leadership, because in my experience, I've never visited a good center without a good engaging leader. Leadership is for me fundamental for sustainable change. And then, of course, the leadership, there is a lot of already done. We have just my colleagues of mine have written a book. It's unfortunately in Dutch, and she is saying that you need a lot of functions as a leader. You need to be a guardian, which means you have to see if everything's going in the direction that is decided. You have to be an initiator of. You have to initiate new things, new approaches. You also have to be a bridge builder. Somebody that can make, that has the competence to two different organizations to make that they can work together. But the leader has also to be a critical friend to others, and he has to be critical from time to time in her or in his approach to where, when after observing what the other organization is doing. And of course, you also have to be an entrepreneur. It means that you have to take initiative, creating new things. And of course, if we look to all those functions of a leader, then we can say only a superwoman or a superman has all those capacities. And in reality, from my experience on, it is so that all those functions can be taken up by different persons, not too many different persons, I think, because otherwise it's getting too complex. But of course, it's like Jacqueline said, it's sometimes very difficult to find margin values. I know we're also personal. I think in most cases you have to divide the function between different persons. So that's quite general what I think about that.
Thank you very much, Jan. It is clear both from your reflection and Jacqueline's response to this statement that integrated work requires an holistic approach and needs to involve all levels at the same time, and there are a lot of different angles to make integrated work successful. One of the issues we decided to focus today, which will be the topic of our second statement, is the attitudes and values of professionals working with disadvantaged families, because many times these integrated services are represented as a very good response to the context in which hard-to-reach families are living in. We would like to show a short video that shows you another center from the UK, from London, another children's center from London, which will introduce us to the second statement. Integrated services are particularly sorry for the noise. Integrated services are particularly seen as a key response to the multi-faced problems many families are experiencing today: poverty, discrimination, and increasing inequalities. A characteristic of many integrated services, like the one we just saw in the video, is working in an integrated low threshold way for hard-to-reach families. I would like to ask Jan, you have been working for more than 20 years as a pedagogical coach in early years services in Ghent, a very multicultural city where poverty and exclusion are affecting the lives of many children and families. What can you tell us about the attitudes and values of professionals working with disadvantaged families?
Yeah, during my career, I did a lot of research by looking at people who are very good in working in the context of diversity, and then to look at them and to see which kind of competences do they have. And what I've done it together with ISA in many different countries like Serbia, Morocco, and Mexico even, and then some Western European countries, but also in my own country. And a couple of years ago, we put all the narratives together and we looked at it, and we came to four very broad competences. That is an openness to dialogue with parents, with colleagues, with children, on the basis of reciprocity. That is very important. Then a second one is that we have to have an engagement and an ability to work towards social change. And there are several workers who work with in a context of diversity who formulated in a way that they were saying, I want to make the difference for a child or for a family. So I think that's very important that you have that you have that motivation, that you can contribute to social change, that you can change the life of people. I think that's very important. And then another broad competence is the ability to reflect critically on the own pedagogical practice and on the one of the team and on the one of the institution or the integrated center. It's very important, I think. And then a fourth one is the ability to create new pedagogical knowledge and practice. It means that we have no clear answers for, you can't teach in a school for social work or for pedagogy or for whatever. You can't teach for every answer, for every question that a practitioner is facing. You can't say that we have an answer for that. We have to create the answers ourselves, and I think that is very important that we have those four competences.
Thank you, Jan. Thank you very much. I would like to remind all participants that if you like to post questions during the discussion, you can do that on the questions panel on the right of your screen. And I also would like to remind you that our panelists provided us with two handouts, which you can also find in the webinar panel on your screen. The photos we are watching now, they come from Belgium, from Ghent and from Brussels. These are some of the centers Jan Peters and his colleagues are working with, and these are integrated services that work in a context of diversity in Ghent and in Brussels. Jacqueline, I would like to ask your opinion about this statement. How is this issue of attitudes and values of professionals reflected in the research you have conducted so far?
Well, I think the thing that we found when we were looking at the impact of Sure Start was that there was a sense that the people who created the Sure Start programs thought that once they were there, people would be so excited they'd come and take up the services. And what we found was that after the first year the programs had been in place, we looked at how well 9-month-old children and 3-year-old children were doing. And in fact, we compared them with children in similarly disadvantaged areas that didn't have a Sure Start program. For the less disadvantaged families, if you like, things were looking good. There was better parenting and better child development, language and social emotional. But for families with a teen parent, for families where there was a lone parent, or families that were workless and nobody was employed in them, for the lone parent and workless, the children actually had lower verbal ability in these areas than the ones that didn't have Sure Start. And for the teen parents, they had poorer parenting and poorer child behavior. And this obviously caused a huge commotion in the media. Lots of newspapers took it up and said, you know, this is money poorly spent, why are we doing this? It isn't making any difference. But what had been missed by the programs was that you actually have to really seek out and nurture and bring in, draw in the families who are most disadvantaged. They're not going to come to you. And the most vulnerable will need an awful lot more care and attention to be able to let them know what services there are. There were probably services that would have benefited them, but they just actually weren't coming to them because they were generally more disaffected about services and professionals altogether and didn't necessarily see that they were going to help them. And the video we saw of St. Stephen's shows a wonderful way of initiating contact with families. Obviously in pregnancy, most families would want some sort of medical care in pregnancy. Some groups are less able to do that than others, we found in the UK, but generally speaking, that's one of the best ways to identify families and to identify any vulnerabilities and to link them up with other services. So that's why that centre is such a stellar example of a well-functioning children's centre, because it has brought in midwifery, which isn't necessarily an easy thing to do, because we found that health as an agency was much less inclined to work with other services than others were, because they felt that they were sort of secure in themselves. They didn't need other agencies, but the other agencies needed them, because that's the way to identify families and to get them at a moment when they're having something positive happen. They're going to have a baby, and then from then on they should be able to sort of be hear about all the other services. So that's a good way to ensure that parents and children will receive the services that they actually deserve and want, and not what professionals think they want. It's a way to make things much more accessible. It isn't just good enough to have them there. You have to draw people in at the right moment and in a way that's positive.
Thank you, Jacqueline. What we have seen from the videos we just showed, and also from your answer and Jan's answer, is that integration can take many different forms, and it can involve informal, non-formal and formal activities and services, and it can be only at the level of community, but most probably it goes up and includes institutions and policymakers as well, if it works successfully. A very common assumption when talking about integrated services for young children and their families is that those services must be under one roof in the so-called one-stop shop. However, there is mixed evidence for the importance of co-location as a key driver for integration. I would like to ask both Jacqueline and Jan, what do you think? Can you have a successful integration of services when services are located in different buildings or different locations in the same community? Or is it a shared location an essential prerequisite to deliver high quality, accessible integrated services for children and their families? I'll go to you, Jan, first.
For the moment, we have since 2014 we have a new law on which we called Houses of Children, and in the Houses of Children, all the participants can choose if they are working together in one location or if they are going to work on different locations. And I think it's good that they can make that choice, because in some municipalities it's so that they have the possibilities to put them all together and to create one new service, but in others it's much too difficult, and they are choosing more for for they stay in different organizations, but they have some things in which they work together. I think it's better to go in that direction of letting the choice, because when you force people to work together, and when it's very difficult, then sometimes it doesn't work, and you lose a lot of time and energy and money also. And so I think it's better that that you keep the choice. You have in the so-called community centers, it are childcare centers which have then extra functions, for instance, in Brussels, in Molenbeek, you all know the word Molenbeek from where the extremists came from to did the attacks in Paris and in Brussels. So a very, an area with a lot of social problems. There you have a fantastic childcare centers, and they not only give parental support and they help people. There you have healthcare, but also they try to help them to find employment, because if you want to get rid of poverty, then it's very important that you have a job, and they are very successful in giving people the opportunity also to become childcare workers. And some of them have already now a bachelor degree, and they are working now in all different centers in Brussels. So it's quite interesting. And then in the film you will see in a couple of minutes, it's from Ghent, and in that center has got a prize, an international prize from a foundation, the Evans Foundation, an international peace prize, and they got the prize because they work so much on social integration. And in the film you will see some examples of how they bring the neighborhood together in the childcare center, and also how isolated persons that live all alone in very simple apartments, how they bring them together, give them a task in the childcare center so that they can meet people and that they can live together. It's also they have also a lot of projects for new immigrants, so that they can get to know other people, other young parents, and so that they can get out of the isolation. Shall we look at the film now, or is it?
Say something about the video we just saw?
Yeah, I think I hope it's clear that, for instance, at the end you see how children from between 6 and 12 are helping in the childcare center. So it's all kind of ways of bringing people together, elderly people, children from the primary school together, helping the parents to look for a school. So I think it's very important that there is a whole network around the childcare center. So it's a different approach than bringing all the different organizations together in one building. But of course, it can be interesting to bring them together. It's interesting to see that there are also other ways of working together when you are not in the same building.
Thank you, Jan. Jacqueline, what do you think about this issue of co-location or non-co-location?
Well, it's been argued about. Certainly the one-stop shop has been put forward as something that's going to help families because they're perhaps coming to some location that's non-stigmatizing. So if they're being offered family support, but within a local children's center, nursery school, then it's like just going to school, and they don't feel that it's they're going to be identified as somebody who needs help. And the early guidance for the Sure Start programs was that particularly early childcare and education should be co-located. But others have argued that it's much less important to co-locate than to have shared objectives, and that's what brings people together and helps families, not that it's all in one building. And a House of Commons Education Committee just recently concluded it's more important that services work together and parents are helped to find their way between them. Parents should not have to tell their story several times to different people. So it's sharing of information actually that's important, more specifically than co-location. We had some interesting, quite amusing information from some case studies we did of Sure Start programs, where the ones they had money to buy new buildings, and some of them did build new buildings, which were meant to be sort of shared space that can be used for different purposes and so on. But some of the professionals, particularly health visitors, insisted that they had to have demarcated space, that they couldn't share their space with anybody else due to confidentiality. They wanted a space to keep their documents and data and so on, and didn't want to have an area where somebody else might use it. Another place was, we were told that the play workers who held play sessions were told that their services were too noisy because the children were making too much noise playing, and it shouldn't be that much noise near postnatal services. And another was told that the parent cafe had to shut down because it was too risky to have hot drinks around children. So the idea of bringing together a diverse set of services for the parents, drop-in play, drop-in chats, and health services and education doesn't necessarily always work that well. And I think that partly the problem was that the architects who designed some of these new buildings really didn't consult thoroughly enough. They had some ideas of their own and didn't really know an awful lot about young children families. But we did actually find in other part of our evaluation that co-location was linked with good multi-agency working, that it did seem as though they could get through their problems, and services were much more likely to really get together, share training, have shared supervision, shared in-service, if there was one building, as long as it was designed so that some areas could be perhaps special for the health, and that play wasn't interrupting more quiet activities that were needed for other purposes. But it's not a straightforward thing at all, and I think that Jan is right that it's much more important to let the community resources that are available and people's wishes drive this sort of decision, and not force everybody to go into one building, because that's sort of the way it's meant to be, and that isn't going to work.
Thank you, Jacqueline. Yeah, it is clear from both you and Jan that the presence of a shared vision and the ongoing learning among practitioners and the capacity to listen and to involve the community are key factors for the success of integrated services. I would like to tell you that we received a very interesting question from Nurper Ulker from the audience, which brings us to think about a different angle about integrated services. She's very pleased with our webinar, and but she points out that most of the models we are presenting come from the UK, from Belgium, and other European countries, and she is curious to understand how can integrated services be set up and run where the workforce is not in place and systems are weaker than in European countries, and also if it's a question of lack of resources or lack of political will, lack of capacities, for example, of the workforce. Jan, would you like? You have done a lot of international work supporting NGOs in the Balkans and in other countries. Do you have anything to say here?
Yeah, it's Nurper is right. It's not you don't find them only in Western European countries. Like I saw amazing centers for Roma children, for instance, where that had a lot of multiple functions towards them. It was also about food and about health and everything together in a kindergarten. So it's not always a question that of money. It's more sometimes a question of vision, and I think especially in the former communist countries, they all have a quite a strong system of early childhood education, and in some countries they are now changing it into new kind of centers, and it's very promising, I think. And also, it's not sometimes in Western European countries, the people think that that our initial training is higher than in some of the Eastern European countries, but that's not the case. In most Eastern European countries, the level of training is higher, is on university degree, even for 0 to 3. So I think those countries have a lot of possibilities, but the problem is a little bit that the way that most kindergartens are for the moment organized has to be reinvented a bit. Has to be, but they have a lot of possibilities to do it, and there are some very, very good examples I saw in Serbia, in Kosovo, in Albania, which are also integrated centers.
Thank you, Jan. Actually, this is a very nice bridge to our fourth statement, which brings us to talk about a concept, the notion of competent early childhood care and education system, and the role of practitioners, managers, trainers, and policymakers in making integrated services work successfully. Can you please, Jan, first explain the notion of a competent early childhood education care systems? What does it mean?
Yeah, it started from a research we did with different colleagues a couple of years ago, and then last year we also published a book about it. And the initial idea is that competence is too much seen as the individual responsibility of the practitioner, while in reality, when a practitioner has a very, very good idea, but works very isolated, it's very difficult for that practitioner to go towards sustainable changes and to improve the practice. So we need on every level, and here you have some kind of an idea of the aspects, different aspects of the competent system. So we have to have a competent team, and if you go to integrated centers, then you have to have also competence on the level of the integrated centers, and you have different ways of training. So it's we know from systematic review on the impact of continuous professional development that practitioners do not learn from going only to courses. You need a lot of exchange among peers. You need to invest in the training of the directors. It's very important. You have to organize training events where everybody from the integrated center is coming together. So that there can be an exchange of good practice within the integrated center. And then there are a lot of other very important aspects of training which are important, always with a focus on coaching and on reflecting on the individual, on the pedagogical practice. That is very important. What we also see the last years, and Europe has played quite interesting role in that, is that you have what we call projects of job shadowing, and there is playing the international level an important role, especially for integrated centers. We don't have to invent the wheel again. There are very nice examples in not only in the UK but also in Germany, the Familien centers in northern Italy, like I said, in some Eastern European countries. So it's important that we that practitioners and directors get the opportunities to visit some of those centers, not only for half an hour or for two hours, but with job shadowing within the Erasmus Plus project, they have now the possibility to go for a week to other countries. And I did some interviews with people who came back from such visits, and they said they never learned so much in their whole career than from working in another context in another country. So we have to look for, especially for exchanging of good practice within a city, within a municipality, but also on a larger scale within Europe. And then, of course, on the level of the government, we need to have it's important that we give incentives that bring people together. We see it in the project we have here in Flanders with the houses of children, that if you give a kind of an incentive, then it's much easier for the organizations to start to work together. So we have to have also on the policy level, we have to have the same ideas about which kind of integration we want. So therefore you need to have a lot of advisory groups where practitioners who work on integrated centers are coming together with policy makers and with researchers, so that we have a shared vision on in which direction we are going with the integrated centers. So
Jan, you mentioned the incentives for the centers. What kind of incentives?
Financially concrete, and also making that a national government is also influencing the local government on municipality level to support those kind of evolutions. So we are seeing that now after 3-4 years, it works quite well here in the Flemish community of Belgium, that the local government has now also is convinced of the importance of going to more integrated centers in early childhood work, and it's important that you have that the national government is giving incentives to the municipalities so that the municipality has the opportunity, have the possibility to go to work with the local organizations towards integrated centers. So money is quite important, of course. If there is no money, it's quite difficult. But I think on the long term, if you work with integrated centers, it has much more impact than working with separate centers, also financially.
Thank you, Jan. Jacqueline, what is your experience and professional opinion about how practitioners can be best supported in integrated work?
I was really fascinated by what Jan had to say. I haven't got as much experience of this, but certainly through 30 years of talking to early years workers, they really feel that they're at the bottom end of people's perception of importance, that their pay is lower, their conditions and their salary, their progress in careers is lower. And all of that makes a difference in terms of their ability to develop their skills, because if they don't have a chance for professional development, then it's not going to happen, and they usually aren't given the space to be able to reflect or to think about things or talk with other colleagues, as maybe people in schools or universities do. So that's something that can happen at the government level to really increase the importance of the early years, and this is happening in the UK certainly, that there's a lot of talk about how what happens before children start school makes so much of a difference. And so the people who work in those age group 0 to 5 are being seen as more important to society generally, because their work can make a difference to how children then start school and develop and become positive citizens and contribute to the economy and so on. So I think that that's something that certainly needs to happen nationally, and if people at the community level are going to be able to get the sort of experiences that they need in terms of professional development. I think it's very difficult sometimes to achieve this, and it usually comes down to money, that the services that are being provided are running on a shoestring, and so they just can't let people go. But it's clear from lots of research that staff turnover is, if that's low, then quality is high. But if staff turnover is high, which means people are not satisfied with their work and their lives, then quality of the care that the children and the parents receive is low. And that's been shown in lots of research studies. So I think that would be the thing that I'd focus on particularly, is raising the importance of the early years and the staff who work in the early years, and also allowing them a chance to have sort of interesting experiences and have days off that they can visit other centres or talk to other people.
Thank you, Jacqueline. What I take from both your reflection is that mentoring, peer learning, exchange of good practices, opportunities of training, as well as political willingness and the availability of resources are very key factors to support practitioners working in integrated services for early years. The time at our disposal for the discussion on conditions for interagency work from the perspective of those in a position of leadership is coming to an end, and I would like to invite all the listeners to watch one last video that nicely summarizes some of the key points that were made by Jacqueline and Jan during the webinar. And also gives some valuable inputs about the role of policy in creating the conditions for integrated work. This is an extract of a longer video produced during the Transatlantic Forum on Inclusive Early Years, which was held in Dublin in 2015. Now I would like to thank Jacqueline and Jan for their participation today and all the inspiring insights they have shared with us. I also would like to use this opportunity to thank all the listeners and also the positive feedback from listeners that we received about the webinar, and remind everyone that the recording of today's webinar will be available on the website in the next few days. I would like to take this opportunity to ask both Jan and Jacqueline if they have any final thoughts they would like to share.
Jacqueline, do you want to start?
Well, I think it's fascinating. As I was watching that last film, I was thinking about an experience I had on a committee that was trying to do something fairly simple, work out how there could be assessments of children at age 2, so that anybody who was needing maybe language therapy or something could be identified. And of course, some of the children would be in childcare centres, some would be in nursery schools, and some would not be in any sort of setting, and so would be the health visitor would be responsible for this assessment. And it took about 3.5 years for them to even agree at what age. Should it be 24 months, should it be 30 months, what should we ask, how do we do it? It was an really, really elaborate process, but it was the only way that you would ever get these different professionals to agree about one fairly sort of straightforward thing that was going to help, hopefully, children's development. And I think it just summarized for me what's really challenging about all this work. It all sounds very fine when politicians talk about it and create sort of ideas that they, promote and say this is going to change society, but there have been decades of experiences of how to do this. And one of the reasons I did my second handout on enablers and barriers is that there are many more barriers than enablers, and unfortunately that's been the case with everything you read, that there are many more barriers to successful integrated working. And so it's really is an ongoing challenge, but one that's essential to work through.
Yeah. I just want to add that when we organized the Transatlantic Forum on Integrated Centers, that we organized in total 8 of them, of such forums, and it was always with policymakers, researchers, and people from the early childhood sector, that the interest in integrated center of policymakers was huge. So for the listeners who are the participants of this webinar, if you want to work around integrated centers, you will always find policymakers who are very interested. It's a topic that they like and that they want to invest. And of course, I agree with Jacqueline that it's not always easy, but it's sometimes a good way if you want to work with policymakers and to convince them to invest in early childhood education. I think integrated centers is a quite interesting topic to convince them of the importance of investing in the early years.
Thank you, Jan. It's Thank you very much. And I think one key lesson here is that flexibility and the capacity to adapt to the idea of integrated work to the local context needs to be a priority if you want to implement integrated services for the early years. There are no magic recipes to make it successful everywhere. If you have any feedback or questions about the webinar, please address them to Michaela Ionescu, whose email should appear on your screens now. The next webinar in the series will happen in December. Keep an eye on the Early Childhood Workforce Initiative's website for more information. And don't forget to register for the Early Childhood Workforce Initiative's newsletter for updates and to visit our website, Facebook, and Twitter pages. Once again, a big thank you to our panelists and to you, the listener, for your participation today.